Hi, this is Captain Yasmin. I welcome you all on behalf of Seabird International, and I'm an OET trainer over here. And most of the students, they are having problem in the speaking module. So today I have come here with the 5 communication strategies which you're going to keep in your mind, and definitely you can perform better in your role play. So let me just discuss the first one, that is focus on the needs of the other party. Yes. Because if you're going to focus on the needs of the other party, then definitely you can perform better. Because most of the students, when they are getting a role play card and they are getting 3 minutes for just reading it or to just for the understanding, at that time they keep on planning that how they are going to start the role play and how they are going to perform in that and how the examiner is going to ask the questions. But it is totally wrong, because if you guys are going to predict that thing and if the examiner is not going to respond in the similar way, then definitely you will lose the confidence. So it's better to not to just predict that how he's going to perform or how he's going to respond. So it's you just focus on the needs of the other party and that what exactly he is asking you. If you're going to listen him carefully, definitely you can give the answers properly, because it's just a communication or it's just a conversation between two people. So don't predict the things. And the second is explain your point clearly. Yes, that is very important, because if you guys are not going to explain the points in a simple way, then the other person will not come to know the exact meaning. Because if you guys are explaining the terms in the medical terminology and you just keep on explaining the things in your own language or with the hi-fi vocabulary words, then definitely the other person will not come to know the exact thing. And even you have to keep one thing in your mind, that the patient is sick, patient is not feeling well, patient is having pain somewhere, and you people are using so hi-fi vocabulary, then definitely the examiner will be having problem. So it's better you just explain the things in the simple way or in the simple terms that the person can understand easily. As we can take an example, like if you are going to administer an injection for tetanus, so first you have to make him understand that why the tetanus injection is important and what are the what are the side effects and what are the benefits or the merits of taking this injection, and if the person is having minor side effects, then how he's going to tackle that. Or you can just talk about some prophylactic medications as well. And then the third one, that is try to avoid hesitant language, because that is really important. Most of the people, they keep on using the fillers. I know it is natural. Right now I'm also having this problem and I keep on using the natural fillers. I know it's important, but when you are performing in your role plays, it's really important that you should be very sure. Like if I'm going to use the word I think, okay, because these sounds are natural, I agree. But if you are telling that person I think, that means you're telling the examiner that you are a little confused and you are just trying to impose your thinking on that specific context. It's better to use it, but don't overuse these fillers, because that is really important. Even I keep on telling the students, if you have to speak in flow, try to use the fillers, but it should not be in a repetitive way. So please try to keep this thing in your mind, this is my filler. I keep on telling the students, try to keep this thing in your mind. So this is all, but try to avoid it or try to use, do not overuse it. And let's move on to the fourth point, that is use positive rather than a negative language. Yes, that is really important. I have acquainted so many students that they keep on telling this thing, okay, no, you are wrong. Or whenever I'm performing with them as a patient, when I'm telling that, okay, I don't feel like doing it because I have a bad story in my mind, or I am not confident in doing this, going for this procedure, because it may even go for some negative, what I can say, there will be some impediments. So the thing is, if you people are going to explain each and everything, that is really important, as you're going to cover all the 3 points. But here, this is also important. If you're telling that person, no, you are wrong in this way, or you are just telling that person that basically, no, that's not right at all, because it's really important that if you are telling the other person that you are wrong over here and you are thinking wrong and you are not understanding that what exactly I'm trying to say, that is really offensive for the patient. So it's better to explain the things in a better way. If you are telling a person that you are wrong about this, it's better you can say, I can understand your concern, ma'am, but it is really important. You can talk to that person in that way. It's better not to use this offensive way while dealing with the patient. Then the fifth point, the most trickiest one, that is mirror the other person's positive gestures. Yes, because if we are mirroring the person's gestures, then definitely that person will listen to you in a more careful way, because the person will think that you are also talking to them in the similar way. So it's better that this is really tricky. Why? Because if a person is not talking to each other, or if a person is not talking to that person is not listen to that person in a careful manner, then definitely that person will lose some interest in talking. So it's better if you're going to use some gestures in a positive way, like if a person is sobbing or person is apprehensive, and you are showing being a listener or being a health professional, being a nurse, if you are trying to show your sympathy or your empathy towards your patient, and you're showing your positive attitude towards that person, and you're listening to the person carefully, definitely that person will be explaining you things in a better way. As we can take an example, like in our nursing, like what I can say in college, I think it was just the first day of our college, I have learned this thing, the acronym, you might be also like know about it, that is NURSE. N stands for noble or knowledgeable, right? So basically knowledgeable. And then U stands for understanding, right? And R stands for responsible, and this one is sympathetic, and last one is empathetic. So I hope you guys remember this acronym, that is sympathy and empathy. If you people are not sympathetic or empathetic towards your patients, then definitely that will be like not properly fulfilled. So it's better while talking to your patients, please try to show your empathy and sympathy, then definitely that person will elaborate the things in a better way. Because as you can say, there are so many patients, like if the patients are reluctant or patients are not talking to you, maybe in the initiation only, the examiner is telling you that, okay, I don't feel like talking to you, can you please leave me alone? In that scenario, this point is going to help you. If you are going to mirror that the gesture of your other party, then definitely you can easily respond in that way. Because if a person is angry, patient is not having hope of just tackling the situation, like I can just take an example. If a patient has already lost his hope in living and patient doesn't feel like discussing it with you, but being a health professional, it's our moral responsibility. We have to gain his trust, and then we have to make him understand that he should elaborate the things in a better way, and then only you can help the person. So it's better you just keep on working on these points as well, because it is little tricky, but if you are going to work on these points, then definitely you can attempt your role play in a better way, and keep on practicing these points. I know it is like these are just small things, or you can say these are the bigger things, but this means a lot. If you're going to keep all these things in your mind, you can perform your role play in a better way. So all the best and keep practicing. Stay tuned with us. Have a great day.